welcome, welcome, welcome. It's great to be here with everybody. I know there will be some more that are coming on as we get going. So we've seen there's a lot that are registered for this evening. So we're really excited to have you all here. And we're going to share a little bit about 3 ways that stress can affect the thyroid. So there are so many ways that the thyroid is affected, and there's so many things that the thyroid affects that these topics can just go on and on and on forever. But I figured that this would be kind of one of those cool topics that we can kind of talk about stress and what its influence is on the thyroid, so that we can start working on how we can be better and how we can reduce our stress and maybe what can we do. So we're going to talk about that this evening, and I hope you guys all have a lot of fun. So this is recorded. So if you are not able to stay on the entire time, just you can shoot us an email and we can send that recording out to you. So this should be pretty simple. I'm going to keep watching and make sure everybody's on mute. So I just ask that when you're not talking, just make sure you're on mute. Also, I'm looking for the chat, and we'll keep an eye on the chat. If I can find it, there it is. So I'll keep an eye on the chat. If you have some questions, please put them into the chat box and we'll try to incorporate them as the best that we can. And we're going to try to make this about 30 to 40 minutes. I mean, it might go to 45, but we also just want to make sure that we respect your guys' time, and we all know that everybody is super busy. So we're going to try to make this short and sweet, but we want to be able to answer some questions that you might all have. So here we go. So a little bit about me real quick, and then I'm going to introduce Elizabeth, who's our nutritionist extraordinaire. So my name is Dr. Shane Stedman. I'm the clinic director and owner of Integrated Health and Integrated Brain Centers here in Denver, Colorado. So my background is I'm board certified chiropractic neurologist, chiropractic nutritionist, certified in nutrition as a nutrition specialist, trained in TBI, and I'm almost at 20 years in practice. So we've been around a little bit. We've seen a thing or two, just like the commercials that are out there. Elizabeth, so she's on and she's going to chime in as well from, throughout the webinar. So there you can see her background. So she's a former athlete, and academic researcher who now works with me. So I get to enjoy all of this knowledge that she's obtained, which is pretty cool. So she completed her undergrad studies at the University of Colorado Boulder and earned her master's degree in food science and human nutrition from University of Wyoming in Laramie. So you guys can shoot some questions at Elizabeth as well. So and I'll kind of check. I'm looking at the chat, so I'm gonna keep my eye back and forth, and you can do the same, Elizabeth. So if you see something that you can pipe in if I miss it. So we'll go from there. Cool beans. All right. All right. So I want to bring this up. So if you guys have not read this book, this is a mentor of mine that I've been with since 2004. So he wrote the book, Why Do I Still Have Thyroid Symptoms? It's a great book. And so what is nice about it is he breaks down a lot of these pathways that people don't know about. And he also talks about Hashimoto's, which is an autoimmune condition. And so I think it's a great book. It's easy. You can find it just about anywhere. We have them in our office. If you're a patient, you can pick one up in the next time. So this is a great book and a great person that I've gotten to know for years. So there's a lot of stuff in here. People that read the book, they end up reading like 2 or 3 times because you just learn something new every time you read it. All right. So before we explain about what stress is, what I think is important is to talk about normal physiology of the thyroid, because I think a lot of people know it, but there's also a lot of people that don't. And so I kind of want to this is kind of the best diagram for this evening that I wanted to kind of talk about. So let's briefly kind of go over what normal physiology is. And I think that'll help you understand a little bit of where the breakdown is. So when you get into thyroid physiology, and I think what most people are used to is that you kind of have one marker ran, such as TSH, and then they base your entire treatment plan and your entire medication plan on TSH and its range. So if the TSH is high, then people are diagnosed with hypothyroidism. If the TSH is very low, then you're diagnosed with Graves' disease or hyperthyroidism. But did you know that it starts way higher than that? And it even starts a little bit higher than what we show on the screen with the hypothalamus. And it's really kind of fascinating that it actually starts higher with serotonin and dopamine and brain function. So yes, you have to have proper brain function in order to activate the hypothalamus. And that hypothalamus, based on all the input that it receives, it actually sends down a signal to the pituitary and says, here's what I'm wanting from you. And this is really important because if we get sick, your hypothalamus will need something a little bit different. If we're hungry, if we're tired, if we're stressed out, if we're overwhelmed, there's all these different factors that go on in our bodies that really kind of dictate and tell the hypothalamus, it all kind of regulates into the hypothalamus to say, this is what we need in order to survive. So it releases a chemical called thyrotropin releasing hormone, or TRH. And that TRH then goes down to the pituitary and says, okay, here's what we need to do. We need to activate or release thyroid stimulating hormones so we can tell the thyroid that we need X amount of hormones produced. And so that whole signal takes place by so many different factors from, you can see there's like inhibitory feedback. There's different types of feedbacks that take place because we got to keep this regulated. Since the thyroid impacts every single cell in the body, as you'll find out here in a sec, we have to make sure that everything is working the way it's supposed to. So the TSH will activate the thyroid, and the thyroid's main producing hormone out of this is T4. And so a lot of people go, well, why is it T4? Well, the biggest reason is because it has 4 iodine molecules on it. So they name it T4. Now it converts over into T3. So the body actually takes one of those iodines off, turns it into T3. And the T3 is where all of the magic happens. So this is what goes into every single cell in the body. It gives the cells energy. It keeps your metabolism going. It turns things on. And this is why we want to kind of this entire pathway is so that we can say, if we know where the pathway or how the pathway works, I'm going to find out who's not muted. All right, so if you're not muted, please mute. And I found the culprit. There we go. All right, so what's important about understanding all the thyroid physiology is because if we understand it, then we can start understanding where the breakdown is. And when we understand the breakdown, then we start saying, now we can come up with a treatment plan. And that is what we want at the end of the day is people want to know, what do I do? Not just what do I take, but what do I do and why, and what do we do in the future? So that is your basic thyroid physiology.
And I'll just add too, for anyone who doesn't already know, the hypothalamus and the pituitary are in your brain. The pituitary is kind of on the underside of the brain, and then the thyroid is in your neck, so that we can picture.
Absolutely. Yeah, I think a lot of people actually forget that there's so much brain component to the thyroid, which is kind of why our clinic is always like a neuro clinic and a functional medicine clinic. And we join the two worlds together because, I mean, half of this is found in the brain. The other half is found in the body. Yeah. So if people are picturing it, that's where everything is at. All right. So we talk about thyroid symptoms. Moving things around so I can read my screen. These are some of the things that we tell people, like, do you have these symptoms? Do you know somebody has these symptoms? And these are your typical hypothyroid symptoms. And we're going to focus more on hypothyroid with this webinar. If you want to hear more things about Hashimoto's or hyperthyroid, we actually have a YouTube channel that we have those other webinars. So every time we make a webinar, then we actually post it on our YouTube channels and we post it out there. So, and if you ever want it, we can always give that to you. But for this particular webinar, we're going to focus on the hypothyroid symptoms. So traditionally what you see is hair thinning, or, people are losing their hair, and it's kind of like all over. So you start seeing you can start to see your scalp over time. The outer third, so when you look at the eyebrows, the outer third, they start to thin, or people's eyebrows, they start to get smaller in size. We see the decrease in metabolism, right? This is probably one of the biggest comments that we hear is just like, it's really tough to lose weight. You go to the gym, you're doing everything right, you're eating right, but you're still struggling. So your metabolism can decrease with hypothyroidism. Dry skin and brittle fingernails. Those are kind of the next biggest things. A lot of people talk about how their fingernails, will kind of, they'll split, or they'll get like little ridges, like you see like vertical ridges up and down the nail. That could also be associated with decreased thyroid function. And then finally, constipation is probably a big one. And I'll explain why here in a second, but probably to finish it off is we have depression and we have fatigue. And so what you notice about these symptoms is that everything is like decreased. So when we talk about hypothyroid symptoms, we're talking about like basically everything in your body is turned down. So constipation is a sluggishness in your digestive tract. So your bowel movements are not as regular. Your mood is low. Your energy is low. Your blood flow is low. So you tend to get like cold hands and cold feet. Your healing is slower. Your metabolism is slower. And so that's kind of the best way to think about hypothyroid is it affects every cell in the body. So you're going to see every cell just kind of be turned down. And that's a good way of thinking about it. Is there anything else you would like to add?
Yeah, just in thinking about it nutritionally too, with the metabolic piece, a lot of the time we're thinking about our basal metabolic rate, or our BMR, and that's basically the amount of calories that a person needs to basically accomplish like very basic tasks. So that's going to be like temperature regulation and things like that. So you might also see cold hands and cold feet, or hypersensitivity to cold, things like that as well.
Yep. Absolutely. So those are some of the symptoms that if you go, yeah, this makes sense, then we have to say why. And this is where we're going to kind of talk about thyroid physiology a little bit more, because it's not always about your thyroid underfunctioning. And that's kind of what I think most of us are led to believe is hypothyroid means under functioning thyroid, but that's not why people have these symptoms. There's actually other reasons within that whole entire pathway of thyroid physiology. So that's what we want to kind of break down and educate you guys a little bit more, because then there's some things that you can do to start working on it. So as we talk about a section, we'll talk about, what should be normal, what is abnormal, and then maybe what are some things that you can do and start looking at. And then we'll kind of try to wrap it up towards the end and go from there. All right. So stress, I want to kind of focus on this because we're talking about stress today. So we're going to talk about the three ways that stress affects the thyroid, and we're going to kind of look at the three different areas of the thyroid that can be impacted by stress. And so when we talk about stress, a lot of people, we kind of look at life stress, kids and work and this and that, and you're on the go. And that can get very, very stressful. We also look at work stress, and a lot of people talk about this where, just their job is stressful. They work a lot of hours, maybe they travel a lot. That can also be considered stress. But some other things to talk about too is lack of sleep. If you don't get enough sleep, your body is constantly running on adrenaline. And if you're constantly running on adrenaline, then that's a stress response just the same. So now you're constantly like just running on fumes, as my mom used to say, I'm running on fumes. And that's just that you're trying to go. And that is a stress place to be in. And so people that don't get enough sleep are usually pretty stressed out. And you see this with even like night shift workers, like nurses. There's a whole condition actually called night shift, workers, if I think it's conditioner syndrome. But, where nurses that don't get a lot of sleep or their circadian rhythms thrown off, they start to have all these different types of physiological shifts in their body, and different types of conditions pop up. So we're learning that sleep is really important. We've always kind of known that, but I think the world is finally saying unifiably, if that's a word, sleep is really important. Inflammation. So inflammation is big, and that can be, from diet. So poor diet is next. But we can look at inflammation as being a chronic stressor. So if you have this chronic inflammatory state, your body's always in a stress state. So what are some other things that are good to add? And I'll let you take over, Elizabeth, if you want to add a couple more things.
Yeah, sorry about that. Yeah, and stress is interesting because it can be kind of hard to quantify in our daily lives. We know we're feeling stressed out, but we don't always know where it's coming from. Other sources of stressors can be even environmental. So you're sitting in traffic and you're maybe exposed to pollution in the air, pollution in the water, along with diet and things like that as well. So,
oops. And I think I went back a little too far. Okay, we'll talk and then we'll move on to this. But I think another one that we were kind of mentioning about this in the office the other day is that even people who exercise all the time and they're like, I run 10 miles a day, 7 days a week, I'm super healthy. That is also a stressor. So even overtraining actually is a massive stressor that we kind of see that in Colorado. That's kind of one of the things that people are known for, like overtraining here, and people do it well, and some people just don't. But there's a lot of like metabolic overtraining syndromes and all sorts of like really fascinating things that are out there. So, with that being said, we got to look at our stress. That's important. So we're going to talk about the 3 ways that stress affects the thyroid. So here's the 3 pathways that we're going to focus on this evening. The first one is the pituitary. So we're going to break that down, talk about that a little bit more. And then we're going to talk about that T4 to T3 conversion. So we talk about there's 4 iodine, your body takes off 1, and now you have 3. So that's a T3 hormone. And then we're going to actually talk about the thyroid receptor site. So those are like the 3. Now there's other areas, but we're going to talk about these 3 because they have some pretty significant roles in how the thyroid goes from point A to point B. All right. So first is the pituitary. So like Elizabeth said, that's in the brain. That's in that bottom part of your brain. It's a little, we look at pictures of the brain in textbooks, or if you've ever seen a picture, it's a little hangy downy thing that kind of looks like a little like water droplet that's sitting in your brain. That little pituitary, people call the master controller of the body. So your pituitary not only sends down a signal to the thyroid, but it also sends it down to the ovaries, the adrenals, the testes. It sends down signals all over the place because your pituitary is trying to keep everything together. And so when the pituitary is off, then that's when you see everything off. We've done some different webinars on like hormones. And so when the pituitary is off, it can throw off hormones or menstrual cycles. And just to actually put this together, a lot of people go, yeah, whenever I'm stressed, it throws off my hormones and my menstrual cycle. Absolutely. Because when you're stressed, it throws the pituitary off. So we're going to talk about that same concept as it's related to the thyroid. So the pituitary, you remember, sends down that signal. I think I got that. Yeah. So it sends down that signal to the anterior pituitary. And what's important about the anterior pituitary is it also controls the signals for thyroid, progesterone, estrogen, testosterone, and cortisol. And so if you see that whole pituitary is getting thrown off, not only do you throw off the thyroid, but you also throw off other systems as well. So this is kind of our first place that we talk about with inflammation and cortisol. And I put those 2 in there, and I know the word stress is what we're utilizing, but I also want to interchange that with cortisol. And maybe here in a second, I'll let Elizabeth talk a little bit more on cortisol, because I think that's something that some people know, but some people don't really comprehend fully. But anytime you have a lot of inflammation in the body, or you have a lot of cortisol, that actually has an inhibitory, and that's why I put the big arrow with the little dash up there. It creates an inhibitory or inhibition, or it starts to shut down the function of the anterior pituitary. So this becomes like one of the first places that we see. Now, blood work is really important because the blood work is going to give us this information. And the way that it looks is that we start looking at that TSH. And if the TSH is actually low, a lot of times doctors will say, oh, that could be hyperthyroid. but that's only if it gets really, really low. There is a such thing as a low TSH, and that's because the pituitary cannot send down the signal as well as it should because it's being inhibited by inflammation and cortisol. So I'll talk more about that, but I'll let Elizabeth talk a little bit more about like cortisol and where that comes from and how that works.
Sure. Yeah. So cortisol is, it's interesting because it has a lot of interplay in nutrition. One of the biggest things that we talk about in our office is blood sugar and how cortisol is impacting blood sugar. So a lot of people have heard before blood glucose. And if you eat food, then glucose goes into the blood, and then insulin carries that into the cells. If you aren't eating enough food, then your blood sugar can dip, and this actually causes cortisol to increase, this kind of stress hormone that Dr. Stebbins is talking about. And so you can kind of begin to piece things together that if you are consistently having low blood sugar and increased cortisol, then that can affect your inflammation, of course, your stress levels, of course, but also your pituitary as well.
Yep, absolutely. Yeah, and I think that's what's so interesting about understanding all this physiology is that people don't think about that with like simple blood sugar, but if your blood sugar is dysregulated and all over the place, that's a stress response, and that stress response then produces cortisol, and the cortisol produces inflammation. And I think what's even more crazy about that is it becomes a vicious cycle where inflammation can drive cortisol, and cortisol creates inflammation, and now they just feed and feed and feed and feed. So then we run blood work, right? And we look at the blood work and we see that the TSH is low. And so we go, okay, well, that's interesting. So if the TSH is low because of the pituitary, then its impact on the thyroid is going to be low. And so now the thyroid can't make T4 as well as it should. So what we see on blood work is we will see low TSH and low T4. So this is important because a lot of times people have had blood work. I mean, we can pull it up now on our phones. You know, we can look at our portal and we can look at our thyroid panel, right? And if you guys get a chance, you can do this and you can listen to this recording again, but then you can pull out your phone, open up your portal, look at your thyroid markers and go, okay, if they ran TSH and T4, if TSH is low and T4 is low, then that means this is probably coming from the pituitary. And this is how we start putting these patterns together. It's not really rocket science. It's like once you know those numbers. Now, unfortunately, what you'll see is a lot of docs don't run the T4. So you're just left with TSH. So now you're guessing. You know, it's like, well, is this a pituitary issue? I don't know. But if you're not stimulating the thyroid, it can't make T4. It's just really that simple. And if you don't make T4, then you don't have a lot of T3. And then voila, you have hypothyroid symptoms. So this is one area to look at. So I kind of want to educate that whole aspect on blood work as well, because I think this is really important and underutilized when we're evaluating thyroid function. So, all right. So everybody's got that. Anything I missed, Elizabeth? Are we good?
I think we're good.
Awesome. Okay. So the next one, which is kind of one of my favorites to talk about, is this T4 to T3 conversion. So like I said, T4 is the primary hormone that's produced by the thyroid. So about 93%. Okay, so it's quite a bit. T4 is inactive. It doesn't do anything for us. Our body has to convert it to T3. And then T3 becomes the active hormone. So there's actually conversion sites in your body that this actually takes place. And one of them is in the liver. So 60% of the thyroid conversion actually takes place in your liver. And there's an enzyme in there, and this is your geeky part. So it's called 5'-deiodinase. And this enzyme is what cleaves off that iodine and converts it over to T3. Now, stress decreases that enzyme. And that, so with the enzyme found in the liver, and we're decreasing that enzyme, you actually decrease that T4 to T3 conversion. So what's important about this is when we start looking at physiology, we got to talk about the blood work and what does that look like? But if you can't convert your T4 to T3, then you have hypo, thyroid symptoms. Now, the other place that it takes place is in the digestive tract, and it has to deal with your flora. So if you have good GI flora, there's actually some enzymes like it's called sulfatase and acetylase. And these enzymes actually help to convert T4 into T3. And that's about 20%. So we kind of said that 60% of this conversion takes place in the liver, 20% takes place in the digestive tract. And then there's a small percentage that takes place in the lungs. There's a small percentage that takes place in the peripheral tissue, but 80% of this is in the liver and in the digestion. So what would that mean to everybody, Elizabeth, that we need to do to make sure that they have good conversion?
Yeah, digestive health is huge when it comes to the thyroid. Certainly in terms of conversion, so making sure that you have enough active thyroid hormone, but also digestion is huge because if it's not functioning properly, then you're not going to have the nutrients to basically produce thyroid hormone either. So that might be things like you might have heard before, selenium or tyrosine, some of these components that actually make up the thyroid when we have poor digestion aren't going to be absorbed and usable.
Yep. Yeah, absolutely. And that's a great point too, is like, this is how important digestion is. Like, if you can't absorb the things that are building blocks, that's one thing. But then if you're not absorbing building blocks properly, and then you can't convert, you're just kind of like compounding issue after issue after issue. And so the digestive tract actually becomes a very, very important piece of this. And with the liver, we see people that have, things like fatty liver disease. We see different liver conditions. We see people that have, maybe the liver is kind of quote unquote clogged because, maybe they work in an environment that's got a lot of chemicals. They're around a lot of chemicals. Maybe they're full of chemicals, whatever it is. But, if you start altering your thyroid ability to do function, that's not great either. So this is where blood work comes into play, because if we start seeing that liver enzymes are elevated and they have thyroid issues, and you go, are these two related? And that's what we always have to figure out with our patients. But again, looking at inflammation and cortisol, it impacts the conversion of T4 into T3. We know that cortisol decreases gut function. So, because we know that the gut is a rest and digest system, it's not a fight or flight. So if you're in stress mode and in a fight or flight, it decreases your rest and digest. So now we can't absorb, we can't move, we can't convert. And then it also impacts the liver. So now the liver function is decreased as well. So these are things that are really important. So what would this look like on a thyroid panel? And I think this is what's good to recognize, is that you might have normal TSH, normal T4, and low T3, right? And that's a much different pattern than the other one that we talked about. So if a doctor just ran TSH and said, hey, everything looks normal, you're like, oh, thanks, but why do I still have thyroid symptoms? But then you have Dr. B that says, I run TSH and T4, and hey, those look normal. And you go, well, why do I have thyroid symptoms? Because you needed another doctor to run the T3. It's not that hard. It's just one more box to check. But when you check all these boxes and you start to see the patterns that take place, and you go, okay, so T4 is normal, T3 is low. Okay, where's our problem coming from? And this is where we start putting together, is it liver, is it digestion, is it inflammation, is it cortisol? There has to be a breakdown somewhere in the system. Anything else you want to add?
I don't think, well, actually, there was just one other piece with digestion, because I'm thinking back to an earlier slide where we covered symptoms. And when we think about thyroid impacts on digestion, the thyroid is also kind of stimulating the vagal nerve to produce HCl, hydrochloric acid, what we know as stomach acid. So if we don't have enough stomach acid, if we're not having enough, basically, if we don't have enough thyroid to produce that secretion, then we're not going to break down food properly either. And that can lead to symptoms like acid reflux, and indigestion and things like that. So more to your point, Dr. Studman, it's really all tied together. You can see a variety of different symptoms popping up. Those are just, some in particular associated with digestion.
Yeah. So going back to the book that I put up, Dr. Krasian, who's a mentor of mine, so I've lectured with him for years now. And one of his biggest things that I really love is how everything's a vicious cycle. And this is why some patients are so hard to fix at times, is because everything is so intertwined and becomes like this wound up vicious cycle of dysfunction. And I think you're kind of like even going towards that point, but if your thyroid is not working, you can have constipation. And if you have constipation, you have gut issues. And if you have gut issues, it makes your thyroid function decreased. So then that causes more constipation. And then that becomes a vicious cycle, and it's like, so that's what we have to figure out, is how do we break these cycles, to get somebody better. And this is why a lot of times, when patients come in, we're like, oh, we're going to work on your digestion. And they're like, what? It's my thyroid. You're like, no, your thyroid is a gland, but there's so many pieces and layers to the whole functionality of this. So it's just, that's why you have to look at the whole person. Hey, Sherry, so good to see you. I saw her message. Okay, I have to work on that. It's good to see you. All right. It's always fun to see like people I've met over the years. All right. So we talked about the T4 to T3 conversion is that 5-deiodinase in the liver, and then also the digestive tract. So I want to kind of leave and say, what are things that you can do? This is where, and this is kind of where Elizabeth comes into play. Like, how can you improve how you're eating? What can you do to improve gut function? So, I mean, what's a few things that people can do just to make a change today?
Yeah. So definitely when it comes to digestion, we want to consider the microbiome. And a lot of people have heard that term. It's kind of trendy, but really it's just the collection of bacteria that are living in your large intestine. And they're huge. They're signaling to the body. They're producing energy for the surrounding cells in your large intestine. And so one action item would be to feed them. And we feed them through prebiotics, which are basically fibers. So you've got a lot of fiber in fruits and vegetables, in nuts, in legumes, and also grains. I covered a lot of food groups, so hopefully everybody can find one they like. But that's certainly a big piece.
Yep. Yeah. Yeah. The more that it's funny, the more that I've, learned and figured out functional medicine, it's funny how things go back to the basics. Sometimes you see, other podcasts, and I watch other, I listen to podcasts and I see these other people and they're super fancy and they're like, we got to do this like biohacking and this and that. But the more you learn in this field, the more it comes back down to the basics of fiber, and even Dr. Krasian is funny, as again, like I follow him forever. And with all of this knowledge that is out there and all this research, they're really saying that the more different types of fibers that you eat, the better it is for your gut bugs. And so now they're saying, like, you can do all these cool things, just eat a bunch of different fibrous foods, go to the store and find something you've never seen before and try to figure out how to cook with it. And you're like, okay, that's easy. It doesn't have to be complex, but I think too many doctors make this way too complex in the functional medicine space. All right. So before I go on, I'm going to answer Sherry's question. So her question was like, in menopause, how does menopause play a role with the already challenged thyroid? So I think that's a good point, because I want to utilize this T4 to T3 conversion. So we're talking about stress, but when we get into menopause, especially estrogen, progesterone, they actually play a really significant role in the thyroid. Estrogen actually plays a really big role in this T4 to T3 conversion. So we're talking about stress, liver, and digestion, but estrogen plays a significant role in that conversion as well. So you can see oftentimes if somebody's estrogen dominant, it'll actually decrease the T4 to T3 conversion. If somebody is testosterone dominant, it can actually create an over conversion. So testosterone and estrogen play a really big role with that conversion. And then progesterone plays a role with the thyroid gland and how well the gland functions and how well it captures iodine from the system and into the thyroid gland itself to produce these hormones. So progesterone has a pretty big role in that enzyme that captures iodine. So when people are going through menopause, sometimes you can get these thyroid symptoms because the difficulty with menopause is you're getting fluctuating hormones because your body is just trying to figure out what it's going to do, and it's kind of got these signals, and it's just going into another stage. And so in that transition period, that might feel a little bit rocky. Your thyroid can also have that rockiness to it as well. So there you go. All right, thyroid receptor site. This one's like not talked about very much, but I wanted to bring this one up because I think it just explains what we need to be aware of and how our stress affects our body. And we all know that stress affects us. And for some it's easy to work on and some is not. And I'm well aware of that because we see patients all the time from all different backgrounds and all different situations. But I think it's important to say, okay, here's another piece that it affects, and this is what we're going to talk about. So, move my stuff around. So I've been talking about how T3 is kind of where all the magic happens. So we have T4 that converts to T3. And then T3, what it does is it goes into every single cell in the body, and it goes into the nucleus of the cell. And it has a really big impact on physiology and function of a cell. So when we say that it affects every single cell in the body, this is no joke. So this is why, depending on if it's like the cells of the brain, we can see depression. If it's the cells of the skin, we see our skin is really dry. If the cells of our hair falls out. So, and those are things that we just know of. So there's so many other things that we don't know of that is really impacted. So where stress comes into play is that these receptor sites, there's different types of receptor sites, and that's a little too geeky at the moment. But what I want to kind of point out is that with stress, high cortisol, inflammation, it actually changes the receptor site on every cell in the body so that you cannot get T3 inside the cell effectively. And so sometimes you can actually look at blood work and everything looks perfect, but somebody still has thyroid symptoms. And this is what I think stumps a lot of doctors because I don't know what to do with you because you have all these thyroid symptoms and your labs are all normal. So then what? And this is where stress does play a role. And it's hard because I think as practitioners and in the office, then we have to look at a person and say, okay, how do we do or stress reduction techniques? How do we do self-care? Do we work on just improving physiology? Do we work on reducing inflammation? Do we work on your diet? Do we get you exercising? Do you see a counselor? What does that treatment plan look like? But sometimes this is one of the more difficult ones to identify because there's no blood work. But you can have all these thyroid symptoms, and it's primarily stress is your number one cause, and it's at the cellular level of every single cell. So I think that's a big piece to try to figure out is that right there. So I think it's kind of one of those like more of a simple type of analogy response kind of explanation, but so we have to reduce stress. So, and I think that's kind of where we start looking at even like blood work. And I'm going to talk about that here in a second, but I love blood work because we can start like diving into like inflammatory markers and liver markers and thyroid markers, immune markers, and saying like, where do you need to be fixed and what can we do internally and externally? What are things you can control and what are things that you can't control? So that's where we kind of start looking at, but that's kind of like the third really big area that it impacts. So anything else that I missed on that?
All good.
Cool. All right. So lab testing. Oh, went too far. So lab testing. So this is important. So I mean, if you want to take a screenshot now, you can, or you pop up your phone and take a picture. But I think anytime that you're talking about the thyroid and you're meeting with a practitioner, I don't care when, where, who, how, these are the markers that you want to look at. And the reason why is because when we talk about the entire thyroid physiology, when you run these markers, you're basically checking all the way down line. So even if we take this analogy and we say, let's look at electricity in your house, right? If a light bulb's not working, why is it not working? And we check down the line. If it's something bigger like a dishwasher, you say, well, let's go look at the breaker. Let's look at the outlet. Did it trip a switch? Is the dishwasher not working? And so we naturally say, well, what part of this pathway is not working? And that's what an electrician does. If your pipe is leaking or something's going on, then a plumber comes in and they look at every single downstream effect. If your car's not working, you take it to the mechanic and they look at every single piece and they tell you where it's not working. And when it comes to the body, we go to our doc and they run one marker and then they say, here's your medication. Case closed. And so what I want to push against is that you guys say, look, I want to run all of these markers because I want to look at every aspect of my physiology and find out where the breakdown is. Because if I know where the breakdown is, then I know where I need to go for care. And for one person, it might be digestion. Another person is stress reduction. Another person, it could be hormones. Another person, it's liver function. And maybe another person, they need medications. But I think it's good to look at the whole picture and then make the decision on where we need to go for care. A little bit of a soapbox, but anything you want to add to that?
No, I think that's great. Just in my time working with you, I've certainly learned how much blood work tells a story and how it's so important to look at trends and also to consider functional ranges as opposed to your more conventional ranges that are just going to look at whether you have a disease or absence of disease. And so it's good to get this story before that point and get the functional ranges as well.
Yep. Yeah, absolutely. And so, so people are like, well, what are functional ranges? Well, you have these big ranges in conventional medicine that are great. They look for disease. But then if you tighten down those ranges, then we start looking at trends, especially when we talk about conversion. Because if your T4 is on the high end of the range and your T3 is on the low end of the range, that could be an underconversion issue, right? Because they should somewhat convert pretty close to the middle of the range. Or if you have one that's normal and the other one's out of range, and it's normal high and then out low, that's indicative. And I think you said it perfectly. It should tell you a story. And I think that's a better approach than, looking at the piece of paper and go, well, there's no H's and there's no L's, so you must be great. It's like, no. This is the best way that we have to identify function, and until one day we stick our finger in some socket and then tells us like, well, here's your printout. That would be cool. But I think
that would be cool.
It'd make our job easy. That's for sure. Oh right. My goodness. All right. So we want to find out what's the cause. So that's our biggest piece, right? Because if we identify the cause and we know the treatment plan, if we don't know the cause, then we're just trying things. And every once in a while you run into that where you're like, I don't know, but let's try this and see if I'm right. But for the most part, you should have a pretty good idea of what's the cause and a pretty good idea of what the plan of attack is. And I don't want to poo-poo it. If medication is the plan, then by all means, that is the best plan for that person. But there are many times where medication is actually not the best idea. And if you can fix some things and improve your function, medications may not be what is needed for that person. And so I think that's what's really great. And in our office, we have a nurse practitioner. So Dr. Hill is fantastic, where we can identify these pieces and we can look at both, traditional medicine, conventional medicine, holistic medicine, so that's where we're able to put these two pieces in here and then go from there. So I see a great question. Actually, I'm going to answer this before I move on. So we're going to find the cause. So what if the pituitary is broken due to a TBI? That's a great question. I think those are tough because if the pituitary is been damaged or broken, then sometimes this is where conventional medicine may come into play. And so I think it's good to look at numbers, because if the pituitary is broken, but all of the numbers coming out of the pituitary are normal, then that's a great sign. If everything coming out of the pituitary is low, so TSH, LH, FSH, ACTH, if all of the hormones coming out of the pituitary are low functioning, then what do we do? And there are some like peptides that actually can activate the pituitary. Those are some of the things that we actually been working on a little bit more, especially with Dr. Hill in the office. We can look at some of these peptides that can activate hypothalamus or pituitary function. So is that a possibility? Or we try to see what other things are playing a role. There are some medications that actually suppress pituitary function. So is that a possibility? Or do we just do some like brain exercises, or do we activate the brain so that the pituitary is also activated? So can we use something like NAD IVs? So I'm kind of going a little bit on a tangent or a rabbit trail, but I think this is a great question, because it's not super simple as you probably even know this is not super simple. So we look at like, okay, what's the output first? If the output's good, then that's great. If it's decreased or increased, then what can we do to drive it? So can we use IVs? Can we use peptides? Can we use just brain-based therapies, or do we need medications? And that's kind of where there's a time and a place for everything. All right. It's amazing how fast time can go by. So what's next? Yeah, you're welcome. So what's next? And this is what's kind of important is, I think what's next is, if you're looking and you're struggling with thyroid, hypothyroid symptoms and not knowing where to go, I think take that list and take it to a doc and say, will you please run these? Because I want to know everything about my thyroid. I don't want just bits and pieces of information, because I want to make the best decision that I can. And then if you kind of see those patterns, then you say, let me try some different things. If not, you can find a functional medicine doc that's well-versed in thyroid. There's a bunch out there. We're always available. I mean, we'll do a shameless plug. But, I think it's important for everybody to be able to have the information to get help, because we want everybody to be successful, healthy, and happy and enjoying life the best they can. So I think that's the next part, is like, get your blood work done. I think you'll be kind of surprised on what you might see. So with that, so blood work is very important. So kind of in conclusion, blood work is very important. You need to find that breakdown in physiology. And then based on that breakdown of physiology, then we can develop strategies. If you don't know where it's broken, then how are you going to put together a plan? If you don't know where your pipes are broken, how are you going to know how to fix them? If you don't know why your dishwasher is not turning on, how do you know how to fix it? If not, you're just trying things and hoping for the best and making tons of trips to Home Depot. So, so let's figure it out and just save some time, energy, and a lot of times saving money at the end of the day. So we do free consultations. We always do a free 30-minute consultation for patients, because we want to make sure it's a great fit. So again, you can mention the webinar, and if you become a new patient, I'm willing to do the blood work for you. So I got the number there. You can call and talk to Lindsay or Kylie, and they can get you set up for a free 30-minute consultation with myself or Elizabeth. So we can do these for you and find out, are we a good fit, and have your questions answered. And if it's a great fit, then it's awesome. We want to be able to help you. If not, find somebody, run the blood work, and try to figure out how to help and make yourself better. What would you like to add to that before I let these lovely people go?
I think that was a great synopsis. And I think you mentioned this in the beginning. It seems complicated. It seems like there are so many systems, pathways, things that can go wrong. But ultimately, blood work is amazing. Blood work can show stories and trends, and can get to the bottom of what's going on in the body. So there's a lot of hope in that.
I agree. That's a great way to end. There's a lot of hope. I think people get frustrated and down in the dumps with this, and I think going from doctor to doctor is really frustrating, but there is still a lot of hope. So we invite you to do it. So call, meet us, see if it's a good fit, and if so, then we can move forward, and if not, then that's fantastic as well. We just want you guys to be healthy and happy. So, so from Elizabeth and I, we want to let you guys have the rest of your day. You can ask for the recording and re-listen to this again and again and again, and let us know if we can help. Stay tuned. Join. Make sure you get signed up to our Facebook page and integrate our Instagram and all this stuff like that, because this is where we're announcing that the different webinars that we do and the different topics and the different doctors, Dr. Maynard, Dr. Hill, Elizabeth, myself, Ross on the radio show and KLZ on Mondays at 12:30. So you can listen to us on the radio, you can listen to us on webinars, you can come and listen to us in person. Just listen to us. We'll give you more information. Connect with us and stay connected, and we'll learn a lot. So hope you guys have a great night. Thanks for joining us. We'll look forward to seeing you all again.